Sorry, and then mute off. Sorry, unmute yourself, Dr. Kapur, please. You can start whenever you're ready, Dr. Kapur. Thank you.
Om, everybody. Mukam karoti vachalam, mangalam langte giram, yatkipatan ham bande, Paramananda Madhavam, Paramananda Madhavam. Om, everybody. Let's sit straight. Keep your hand in Dhyan Mudra. Keep your neck straight, spine straight, shoulder behind. Relax your body and the mind. You're going to chant Om 3 times from mouth after taking a long deep breath from the nostril. Om. Om Bhurbhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yonam Prachodayat. Om Sarve Bhavantu Sukhina Sarve Santu Niramaya Sarve Bhadrani Pashantu Ma Kashtit Dukh Bhag Bhavet. Om Shanti Shanti Shanti. Let's all pray to Almighty. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional. With these good thoughts, we will start our session of yoga, keeping in mind all the precautions. Do as much your body allows you. If you are recovering from any ailment, please do it very, very slowly. And gradually you build up your strength and the stamina. Hypertensive, heart problems, severe acidity, severe asthma, severe backache, please do it slowly. Do it slowly. Today we have picked up a very nice session, which is very, very important. Hypertension. First of all, I would like to thank the person who requested this. That gives me good seva, to serve the humanity. Hypertension. What is hypertension? We all need blood pressure to pump the blood into our whole system. And hypertension is very, very common. Very, very all over the world. Most of the people are suffering from the hypertension. And this is known as a silent killer. Because people don't know that they are suffering from hypertension. When they go to their GP for any other problem, as a routine, they take the blood pressure and then they label them. Mr. So-and-so, Mrs. So-and-so, you are suffering from high blood pressure, which can be quite worrying, when we come to know. But again, don't worry. This is not one reading the doctor has taken to establish you as hypertensive. Minimum, they do 3 readings, and then they take the average, and then they label you with hypertension. Now, this is happening. Why it is happening, nobody knows. No obvious reason, but there are certain points in various people that we know that they are going to suffer. Like overweight. If we are overweight, we are going to suffer. There's no doubt about it. If we are taking too much salt or sugar, not drinking enough water, and have all the time fried food, the wrong food, not taking enough fruit and vegetables, and too much alcohol. Luckily, we don't do that, but we drink a lot of coffee and tea. And another reason for the hypertension is, stress is the root cause of all the problems. And if we don't have enough sleep for various reasons, we are going to get hypertension. This is well known, and people suffer even from sleep apnea. They are also more prone to it. Then the other thing which is not under our control, our hereditary. We take from our parents or grandparents, high blood pressure. Then the people living in poor condition, deprived area, they are getting. Then this is more common, changes with the race also. Black people, they suffer more than others. Talking about the woman, premenopausal woman doesn't suffer much from hypertension, but after menopause, they are more prone to get high blood pressure. Men suffer more than women. So what to do? And other things are, we are taking certain medicine which are giving up high blood pressure, like steroids. They are well known. Steroids are well known for that. And other thing is, it doesn't apply to all of us, looking at our age. Oral contraceptives, they are also giving high blood pressure. But you can take these messages home to give to the young adult people. So these things we have, and other things, sometimes there's a kidney disorder for various other reasons. Those people are getting more high blood pressure. So depending upon the cause, we have to do the treatment. So we have to sort out what we are suffering. So according to that, we regulate our treatment. The easy treatment, as we know today, yoga and pranayam. This is helping us. There are so many steps of pranayam which are going to help us. Other thing is your laughter yoga. Get rid of all the stress. That is stress buster. So that's why we do a lot of laughter yoga, Now to start the full session further on, I think we have to activate ourselves and be more cheerful. Take away the stress. We want to energize our energy channels, and we can do it various ways. So one of the ways is clapping, acupressure. Come on, go on clapping. Go on clapping, first of all. You are doing so much benefit by just clapping and giving a nice smile on your face. Acupressure is helping. Then it is good for digestive system, good for the joints, for the weight reduction. So many benefits. Come on. Carry on. They say do 3 times day and night. Anybody can do it. Even my joints are pretty bad. I can do like this. I don't have to do like that. Slowly and slowly I'm doing every day, every day. My stamina is increasing. Then I can do like this, quite fast. Do clapping up to the level you're getting your hands quite red. Then only it will help. Next is go on tapping whole body. Start from here. This is you are activating hypothalamus. Take away all the anxiety. Take away all your anxiety, anger, fear. Take away the stress, dementia. Good for the hair growth also. Giving a nice massage. Carry on with a smile on the face. Carry on. Carry on. And come to the shoulders. Try to visualize your body, your anatomy, where it is helping me. At the neck region, this region, and the glands are there, thyroid gland, parathyroid gland. And you know, one of the causes for the obesity is when thyroid is not functioning properly. When the thyroid is sort of hypothyroidism. So we are activating our thyroid gland, and that will increase our metabolism and get it affects the weight. Then coming to here, we are doing again tapping at the collarbone. That is for my respiratory system and for heart. Now come to this point. There are so many nerves there, and we get rid of multiple diseases like for hypertension also, for diabetes, for any alimentary problems. Other side, there are so many techniques to do your tapping. Carry on. No, this squeeze is very important. Over there, the hand should be. And come to your abdomen. The liver, right side, the gallbladder, some part of intestine, some pancreas also getting help. Again, left side spleen, the left kidney is behind. We are going to touch that also soon. What else is happening when you are doing this? You are activating your vagus nerve. That is parasympathetic activation. That will help me to lower my blood pressure and my heart problem also. Heartbeat will come down. Now, going to the kidney at the navel level, go back and do. You can do with your thumb or with the palm. You are activating your kidneys. Because if there's a kidney disorder, you are going to get better. Improve your electrolytes, urea, creatinine. Then come down here, lower part. For the reproductive organs, the woman, uterus, cervix, and then fallopian tube, ovaries, and in the man, prostate and the testes. Come more down, where we are, at the groin region. We are activating our lymphatic system also, which is giving us immunity. Then go down below, here. What organs are there down there at the bottom? Anus, giving us hemorrhoids. We call it piles also. Anal tract, anal fissure, anal fistula. Then come to your leg halfway through at the knee. Here, this area. Good for the varicose veins, for the lymphatic system also. Get rid of any aches and pains. And you can do the whole leg like this. Do calf muscles more. Because there's a pump for the lymphatic system at the calf. Very good. So you go on doing now, we are quite energized, isn't it? Why we have done this? Our body is active and our concentration is increased. That's why I did it. To increase our first concentration. Want to increase the concentration. Many people are suffering from hypertension. Now what happens? What are the symptoms usually? Sometimes there are no symptoms. That's why we say silent disease. It's growing inside, we don't realize. But again, if the hypertension is gone quite serious, you can go from mild to moderate to severe, then there are lots of symptoms which develops. That can be headache, very common. If anybody say, I've got headache, I will say the first time, please go and have your blood pressure done. That is come in your mind, first of all. Go. Eye problem, go for the blood pressure. Headache, dizziness, fainting, they are the late stages. Blood pressure is quite severe there. And then ringing in the ears also. Then passing a lot of water. Again, especially at night because the kidneys are damaged. And then sometimes they feel very unsteady. When they get up from the sitting position, standing, they feel very dizzy. They got a lot of weakness and fatigue. So these symptoms are there. One has to keep in mind. And when it gets more severe, that's severe type. As I said, mild, moderate, and severe. When it is quite severe, the heart is affected. So you can miss your beat, that is arrhythmia is happening, or even you can get chest pain because the heart is not working. You can get even heart attack. And these points are very, very important. Now, one thing is very important. As we are growing up, our blood pressure is going to go up. So what is normal for the old person is not normal for the young. Young is always low level. We say 90 by 60. 90 is systolic, 60 is diastolic. And in the elderly, at my age group, 120 by 80. Now, if the blood pressure goes up more than that, that means you are at a risk of getting high blood pressure. And if the high blood pressure is coming, then there's a lot of life-threatening conditions can happen. Heart disease, heart attack, missing beats, arrhythmia, and stroke, which is so common. What else will happen? You have done kidney damage also. So you will land into dialysis then, or maybe kidney transplant. And other thing is dementia is also happening, and we call it vascular dementia because the blood vessels are thickened, not enough blood going there, and the blindness. Blindness is so common with severe hypertension if you're not looking after yourself. Other thing is your peripheral artery systems are also damaged and the nerves. So peripheral neuropathy is there. You are getting your kidney damage, nephropathy, blindness, and nerve damage. So that's why this subject is very, very important. Many people are suffering in all the countries. So we have to watch out. Going back, it's so easy. We can help ourselves by simple protocol of yoga. Yoga and pranayam, provided we do every day for a long time. We all know the steps. So today I will cover those steps which are most important for our hypertension. You all know the 8 steps of pranayam as I covered on Sunday also. The first one is Bhadrika, Kapalbhati, Bhamri Pranayam. Then we do Agnisar Kriya, which is just a Kriya. And then we do Ujjayi, Anlom Vilom, Bhamri, Udgit, and Pranam. Now, out of all this, now we can see easily, we want to make sure that we are not raising our blood pressure. So do it slowly. Spend most of the time on Bhadrika. Bhadrika. This is the one which is going to lower my blood pressure with the various other benefits also. And then coming to Kapalbhati, depending upon the severity of the blood pressure, you have to keep in mind. If it is a mild blood pressure, you can do it slowly. Slowly Kapalbhati, but again, 1 stroke, 1 second. Okay? Or you can do it less time as you are in that condition. If it is a severe type of hypertension, I will say, please don't do it. Now, it depends what you are suffering, but if you are in really very, very severe hypertension, I don't think you will be coming to the class. You first have to get better somehow, and then you. But so there we are, we can do Kapalbhati very, very slowly at our own pace. Coming to Bhamri Pranayam, I say no. Okay? Same go to Agni Kriya. Alone, we have to spend a lot of time on alone. Maybe half an hour, 1 hour every day, morning, evening, to control my blood pressure. Then coming to Bhamri, that is very, very important. That is going to take away my high blood pressure with various other benefits. Then next coming to Udgit, they are all making our blood pressure to come down, take away all the stress, taking away insomnia also, which is causing us blood pressure. The next one is Prana, that is our meditation. So these steps are very important. Then there are some associated pranayam like Shitali Shitkari. They are also very good for the hypertension. Now, other one which is very, very important is our Chandranadi. Chandranadi Pranayam. Chandravati, we call it Chandravati. We are breathing from the left nostril to lower our blood pressure, take away the stress, giving us cooling effect. So these are very, very important. So we will be doing those today. And the other thing is coming to mudras, because we are very thankful to Sam, who has taught us so many mudras in such a lovely way that everyone is now expert on mudras. Am I right? Yes. So mudras we will be doing. The most important mudra for hypertension is your, first of all, this mudra, Dhyan mudra or Gyan mudra. Then come your Vyan mudra. You are touching the first two fingertips with the thumb. This is going to lower my blood pressure. Then coming to your Vayu, Apan Vayu mudra. This is very good to lower the blood pressure. Then come the Varun mudra, because this is going to increase my water in whole body. Because when the lack of water, we get hypertension. Even you can go in the stage of coma even. So these mudra. Then coming to your acupressure points, the master point, the tip of the ring finger. That is our master point. Then taking away further stress. You all know that we are doing this one also. Take away my worry. Worry is giving me tension. Yes, I am all stressed. So take away my tension, my fear. Somebody is diagnosed hypertensive, I might get it. Fear is in my mind. Then come anxiety. Why I am suffering? This we always say, if we are diagnosed with any condition, so why me? Why me? So that's take away your anger. The next one is sadness. I am sad, I am hypertensive, no confidence. So these we do, this is again acupressure. These are helping us. Simple steps are going to help us. Now what else I should do? Increase the physical exercise. I am overweight. I have to do walking, brisk walk, start with the slow walk, then go to the brisk walk for 10 to 15 minutes and do half an hour every day walking, swimming, cycling, weightlifting. They are all going to help me. And then you can do jumping, your blood pressure not too high. And then you can do singing also, loud singing. When we do loud singing, we are doing our pranayam. Loud singing, listen to nice music, do meditation, and do lot of laughter yoga. But if the blood pressure is too severe, don't do it. Don't do it if the blood pressure is too high. And other thing is, which is most important, your meditation and other going to your asanas now. You are doing asana, but the best one is Shavasana. Shavasana and Yoga Nidra. They are the one. They are going to take my high blood pressure with the various other benefits also. So these are what we are supposed to do to get better from our high blood pressure. Then we have to do the steps to increase our nitric oxide, which we are all doing every day, because nitric oxide is well known to dilate our blood vessels, to bring our blood pressure down. We are all doing, we have to watch what we are eating. We have to eat those vegetables and fruits which are going to increase my nitrate, because the nitrate is the one when we eat, they are converted into nitric oxide. And then watch out, don't do any mouth washes, because they are going to kill my healthy bacteria, which I need for my nitric oxide production. So these are the things. And then we do physical exercise also for the nitric oxide. We do 4 to 5. You do every day you are doing. You are expert on that. But again, if blood pressure is there, do it at a low pace. Don't do fast. Do very gently. Come on. We are sitting, we are doing, we are standing. See, I will do like this. Very, very gently. Very, very gently. I've got blood pressure. I don't want my blood pressure to go up. So I am doing so gently. And do less time. Keep mind on your breath. Don't worry about counting how many you have done. You are doing your Bhamri Pranayam side by side. See, like I am saying, I am hypertensive, moderate, not very severe. So I am very gentle, very gentle. Go on breathing from the nostril. Bhamri Pranayam we started. Do less time to start on. As the blood pressure getting better, I can increase. The other one, you do this one again, very gentle. So the variation is very important in this yoga practice. It can be more slow even. And then doing this very gentle to myself. Very good. Next one, we do this one. Yes, very gentle. I am hypertensive. Another one, you can do your raise your shoulders up. They also help. Very good. Slowly. Then you do your rope jumping very gently. They're all going to increase my nitric oxide. So many benefits. Get rid of all the allergies, even the heart attack. Good for my brain also, this nitric oxide. Even for mouth cancer, they give this treatment. Precursor of nitric oxide for the mouth cancer. So these exercises you are doing, but you are doing at a low pace. You have to do, because if you don't do it, you won't get better. So these are the things we are doing. Why we are so particular about our this blood pressure? Because as I mentioned, the complications of the hypertension, stroke, heart attacks, peripheral arteries problem, the neuritis, the blindness, the dementia. So these are very, very important to keep in mind. And very simple, gentle exercise you can do. Super brain yoga also is very good for this. Get rid of even dementia and giving enough supply of blood to my brain. Do it gently, but not fast. Going down, breathe out from the nostril. Coming up, breathe in from the nostril. All thoracic breathing, no mouth breathing. Very, very gentle. I have got hypertension. Slowly and slowly, with a smile on your face. Going back to the food, as I mentioned, all the green vegetables. Your broccoli, the cucumber, beetroot is very good to lower your blood pressure because that contains a lot of calcium, and the banana, even the kela is very good, banana. Karela even very good. Potatoes are very good. Sweet potatoes are very good because they contain a lot of magnesium plus the potassium, which is going to lower my blood pressure. Banana a day keep blood pressure at bay. Banana a day keep blood pressure at bay. Apple a day keep doctor away. That's what we are talking, isn't it? How this potassium is helping me. There are two ways how the potassium will help me. That's why we take banana every day now. People have just some thinking, if I am diabetic, I am overweight, I can't take banana. That is wrong. Banana has got a lot of benefits. Good for the brain also. Take away dementia, depression, instant energy. When you are going outside, you haven't got anything, keep banana with you. Take it and instant energy will come. So that your anxiety is also gone. Plus, it is increasing your potassium. Potassium works in such a way on the kidneys that it removes more sodium out. That is the idea. Because sodium is high, that's why we're getting blood pressure. So sodium is thrown out from the kidneys. Other thing, potassium works in such a way, it dilates our blood vessels. So the blood pressure will come down. Blood pressure is high because there is a lot of fighting going on with the pump and the arteries, which are getting stiff. That's why in old age, all our arteries are more stiff. And poor heart is working very hard to pass that blood in the whole body. Hypertension comes like that. So there we are. So many things we are doing to help not to get this blood pressure and not to face all that life-threatening diseases. Now we start with a very easy way to get better from hypertension, pranayam. So let's sit straight. Keep your neck straight, spine straight, shoulder behind. Relax your body and the mind, hands are in Dhyan Mudra. Go on breathing from the nostril at your own pace. No fast at all, just slow pace. Try to take deep breath. Slowly deep breath. No rush. And go on chanting inside. That is the one which is going to help us. The Lord's name. That is the best medicine. Om. Whatever you pray, do. But Om, nowadays you can read so much about chanting Om. This is lowering your blood pressure. The heart problem is going. We are having more concentration, increase of memory. Plus, when you say Om, you feel as you got some around your body, protection is coming. Just saying by Om. Other thing is by chanting Om, we are activating our vagus nerve, which is going to help me to lower my blood pressure. So you can do this quietly also, or you can do loud chanting also. Whatever you want, but as we are doing Bhadrika, we are doing it silently now. We are doing our japa inside, continuous japa. Inside, any name, but you do your prayer, but you believe. Do with full concentration, full surrender, full faith, full belief, no halfway. Puran, Purnamida, Purnamidam. That's all we need. Carry on. This is all thoracic breathing. You can put one hand on your chest, other on your stomach. When you breathe in, the chest is expanding, diaphragm is going down, which is pushing my abdomen out. Viscerals are coming out. That's why the hand is moving forward. But this is not abdominal breathing. When we exhale, diaphragm is coming up, chest is constricting, and the stomach is going in. We are increasing the oxygen level in whole body, which is going to activate all the systems. The central nervous system, the respiratory system, cardiovascular system, digestive system, excretory system, reproductive system, and going to make me much happy and cheerful. And you can even lose weight. That is the magic of oxygen. Carry on with full faith. By taking these long deep breaths, I'm going to make my lungs work fully, 100%. When we are having shallow breathing, hardly we are using 1/4 of our lungs. All the air sacs known as alveoli, they are closed. By taking a long deep breath, they are opening up and there's a good exchange of gases. More oxygen going in. The blood will be purified, which will be circulated in whole body. That's the idea of doing this pranayam, long deep breath in by Bhamri Pranayam. Increase your oxygen level. We call it breathing exercises. Concentrate on your body. Is my chest expanding or not? If not, then I'm not doing the proper job. Chest should be extending, getting bigger and get smaller when you're exhaling. And this breath is going to even control my mind and my temperature. Now raise your arms up, rub your palms. Do it about 15 to 20 times to generate heat. Put them on your eyes. Feel the warmth going on your face and the eyes. This is going to increase my vision. Take away other problems of the eyes, watery eye, burning eye, discharge from the eye. Once the temperature is back to normal, then open your eyes slowly, remove the hand, give a good massage on your face. At the lower eyelids, we get a lot of black patches there. And sometimes we get puffiness also there. Especially in the morning, if you see, you might find lateral angle of the eye, at the eyebrows. Again, increasing the circulation of my eye muscles to make them better. Get rid of cataract, glaucoma. Then the side, the temple region, which is very important. There's a big nerve there, trigeminal nerve. If it gets inflamed, give a lot of problems. Take away the tension also. Over the forehead, over the head. Come down like this. Again, we are going to activate our vagus nerve. And there are a lot of lymphatics at the back of the ear also. And plus some organs, sites also. The acupressure on the ears is very, very important. Whole body is there. Any problem, pull it up. Then the middle part, the lower part, pull it down with a smile on the face. I'm not naughty. It's not my punishment. This is my treatment. You have done already super yoga, you know, super brain yoga, by pulling it going down and up. Now do inside also. There are so many organs there where we get problem to get better. More than 700 points, they say, on the ear only. Then come down, activate your thyroid gland, parathyroid gland, vocal cords. Come down here. Then your thymus gland, give a nice tapping there, take away my anxiety. Bereavement and activation of T cells to increase my immunity. Fight against any organs like bacteria, fungus, viruses, and come to your shoulders. Then you can do your tummy also and go down. What you've done, you're giving urja, which is your developed by doing, warming your hands, you know, energy. Simple physics, friction. We created so much energy by friction that we have applied to our body. The next one is Kapalbhati. Again, depending upon the severity of your blood pressure, you have to work it out. Let's say I am dealing with mild or maybe moderate blood pressure. Kapalbhati. Again, many other precautions also. If you're bleeding from anywhere, if you've got headache, epilepsy, feeling dizziness, don't do it. And during pregnancy, don't do it. If you're trying to get pregnant, don't do it. And if you have any major surgery, you don't do for 4 to 6 months. Even for minor surgery, you don't do for a couple of weeks, and then you start using on the advice of your yoga teacher. Very simple example is cataract operation. Every week somebody is going for cataract. So we have to watch out who are going and what we have to guide. Because we are doing what? We are covered by our insurance, you know. We all have got insurance. Yes, am I right? All teachers have insurance to work on the Zoom even. So make sure we are giving full advice to the people. Then other things are, we will do very, very slowly as I am hypertensive. That is the subject today. So let's start it. You can start with Pran Mudra. The tip of your ring finger and the little finger, the tip of the thumb. Put it on your lap. Make your spine straight, shoulder behind, smile on your face, and go on doing Kapalbhati. Very, very slowly. As you are hypertensive. As we are doing, follow all the techniques, you will get better. Hypertension is such a disease which you can really cure yourself. There are so many examples I can give you. But how they did it, they didn't do many exercises. Just breathing technique was normal. 100% normal technique if you follow. Blood pressure can be controlled, no problem. Just by breathing. Very gently we are doing Kapalbhati. Now here try to do your Kapalbhati with Apan Vayu Mudra because that is helping for my blood pressure. First make Vayu Mudra, then Apan Mudra, that's all. Little finger is left alone. Rest are all touched by each other. Very gently we are doing Kapalbhati. So you do according to your own system. If blood pressure is not bad or you're not suffering, you can do with medium speed. But never do fast. Never do fast. Otherwise, blood pressure will shoot up. You will get a lot of backache and you won't be able to do it fully. You have to stop in between. That's why I said don't do fast. And I humbly request it on the Zoom especially. Nobody should do at all fast. Just do slowly or medium speed. The next mudra you can change your Varun mudra. This is increasing my water, which will help me for lowering the blood pressure. Keep the neck straight, spine straight, shoulder behind. Again, you can do your chanting inside, whatever you believe in. Next mudra is Dhyan mudra. You're touching the tip of your index finger and the middle finger tip of the thumb. This mudra has got a lot of other benefits also. It will lower your blood pressure. It is good for any nervous problem. You know, central nervous system problem, ataxia, neuron problems. You know, people suffer from motor neuron diseases. Get better for that. MS also. Here we are talking more about our blood pressure. So this is going to help me to lower my blood pressure. Carry on. Slowly and slowly increase the duration doing these steps. In the beginning, we say do it for 2 to 3 minutes, then increase it slowly and slowly and slowly. Well done. Now in between, we can do gentle exercises also, not too fast, very, very gentle. Same thing, but we do at a low gear, low, with a smile on the face. Because we suffer from multiple problems. Hypertensive having rheumatoid arthritis or arthritis. So we have to do those exercises to get better. Now make a fist wide, fingers are wide apart at the shoulder level. Very, very gently. Then come up slowly. This will increase my muscle power also. My bones, good for my ligaments, bones, joints. And go on breathing from the nostril, doing Bhatrika. Coming up, breathe in, going down, breathe out. Sideways, again at a slow. Then you can rotate your shoulder gently. So you do according to your own body condition. But we have to do it every day, every day. Forward and backward. Very good. Give a nice smile on your face. Well done. Same again, raise your arms up, down, up, down, up, down, up, down. Take it on the side and rotate it gently. Clockwise, anti-clockwise. Other side. Other important point is for the high blood pressure and also for the low blood pressure. Never do fast movement of any part of your body. Whatever you're moving. Now, like I want to do this now, side bending. I will go very, very slowly. Here, I have to watch out. If my blood pressure is very high, I won't be doing this bending at all of my neck. Not at all. If it is mild, yes, then I will. So these are the variations which are very, very important. No neck movement with high, very high or very low blood pressure. Very gently. Even when you're doing your neck exercises, you have to be very careful. You are very, very gentle. See? Breathe out and go down slowly. Breathe in, look straight. Breathe in, go up very slowly. Breathe out very slowly. Sideways also you are going very, very slow. Very slow. I have to do this to get other benefits. Not to get my neck problem. And I am activating my thyroid gland, parathyroid gland. Maybe they are not also working. So I want to give them physiotherapy to those to start working. Then come in the center. Breathe out, go towards the left side very slowly. We're doing the same steps of pranayam and exercises as we normally do, but we just make it more gentle. Now here rotation you can do if it is a mild blood pressure. If moderate, please don't do it. No rotation of the neck at all. We do 360-degree rotation. Don't do it in the beginning. As you are getting better, you can start doing it. So these points are very, very important. You know, you can't do haphazardly. No, because you get damaged. Because whatever we are doing, we have to be careful. So these are simple exercises we have done. Same thing you can do with your legs also. You can move your legs up and down gently. Right and left and rotation. You can do the rotation also. See? Very, very gently. But if you have no problem, you can do fast. Clockwise, anti-clockwise. Other leg. Lift it up first. Forward and backward. Keeping in mind your Bhamri Pranayam. You spend most of the time on pranayam. Whatever we are doing, even with the poses, exercises, poses, asana. Rotate clockwise, anti-clockwise. You can do cycling also gently. Everything what we are doing otherwise as a full protocol of our yoga practice, we are doing. Reverse gear, other leg, cycling, very, very important. Okay, well done. Same thing you can do gently, your Chakki Asana, very gently. I'm not moving my head at all, just gentle. If you have no problem, then no, we move quite a lot backward and forward. But here as hypertensive, you have to be very careful not to move your neck at all. Because many times we are obese and having hypertension. So we have to do the exercises to lose weight. And they are very simple techniques. Then you can do your churning also gently without moving your neck. Very, very gentle. Very good. Carry on. You're doing very well. Well done. The next one is Anulom Vilom. See, I'm not doing other like Bhamri Pranayam or Ujjayi even, because Ujjayi you have to be very careful with the Ujjayi. So, Anulom Vilom, very simple. Everybody knows how to do it. Close your right nostril, right thumb. I do with the Vayu Mudra. Breathe in from the left nostril, slowly, slowly in, deep breath. Then you close your left nostril with these two fingers, the middle and the ring finger, gentle pressure on the left nostril.
Sorry, Dr. Kapur, I have to leave for another class. Thank you.
Pardon?
I have to leave the class. I have got to take another class.
Okay, never mind.
YouTube
All
पर
the best.
देखेंगे. Thank you.
Carry on with your hard work.
Yeah.
Thank you. Thank you, Mohan Bhai. Again, go on chanting inside, whatever word you prefer, Om, any Shabad, any Dhun, any mantra, carry on. This is going to lower the blood pressure and many more benefits like on the heart, on the excretory system, digestive system, central nervous system, cooling the mind, taking away my dementia, anxiety, fear, anger, greed, competition. And this is going to open up all the nadis, all the nerves. There are plenty of them. 72,72,000 and 10,201. So many nadis which are going to open up. We are doing alternate breathing to activate our brain. The right side is connected to the left brain. The left side known as Ida. Chandra Nadi is connected to your right brain. So when we are doing this exercise, we are activating our third major nadi known as Sushmana nadi. And that's how the people are getting all this energy. Let's talk about Kundali Jagran. That's what is happening. And here when we do Alom Vilom, there's not much sound, And then there's another step which I'm going to touch it to get better with the hypertension. Chandravati Pranayam. Let's carry on with the Alom Vilom for a short time. And these are the one which is going to help us lower our blood pressure. Take away our anger also, greed, enmity. And production of good hormones. The loving hormone, oxytocin, which is produced by doing all this. Serotonin, which improves our mood. Get rid of the bad hormones, cholesterol. Cortisol. Cortisol is the one which is making us anger, always raising the blood pressure also. Production of good hormones, getting rid of bad hormones. And going to lower our weight problem also. Control the lipids level also. Make my liver better, my kidneys better, intestine better, I can digest my food. And if these things are disappear, my tension will go and I won't get hypertension. Stress, any way to get rid of stress. Stress is what? Stress is too much salt. That's what Swamiji was saying this morning, luckily. What is stress? Too much salt in the body. People who are normal, not stressed at all, relaxed, they are taking salt, they are not getting blood pressure. Stress is causing. Stress is extra sugar, giving diabetes. Stress. Stress, joint pain. Stress is giving us respiratory problems. So stress is the culprit for everything. And this yoga practice, which is so simple, is going to get rid of my stress. This is the first effect we are seeing in most of the people. They are so happy, cheerful, no stress. They are sleeping better. They are eating wisely, having healthy food. This is the effect of yoga. And plus, Swami is doing a lot more things. Please carry on with your Alom Vilom. He is talking about the things have changed for the last 2 years. I can tell you quite openly. When we were trained 15 years ago, it was different. Now he is talking more about Havan, Yag, to get rid of any problem, this hypertension even. Then he is talking about fasting. Then he is talking about water therapy, the mud therapy. And other new things have come is your leech treatment. Giving you leech treatment to get rid of your poison from your body. So many new things have come. Then they are talking about the Bhakti and Bhakti. Bhakti and Bhakti. Bhakti, they are giving like anima. And other they are doing with it, producing like a ball and putting some medicated oil for any. And then for hypertension, they are talking about this Shirodhara, giving oil treatment medicated again on your head. So things have changed now. They say just simple yoga is not going to get rid of the serious problems. You have to add up everything. Then the Ayurveda medicines also. But they only take for 7-8 days and they are getting better. They're coming out from there. So this is what at least here we can do. We haven't got other facilities. We can do increase the duration of pranayam, like Alom Vilom, Bhadrika, to get rid of our hypertension. The next one I spoke about Bhamri Pranayam. That is very, very good for the hypertension. So let's start doing it. We'll do 5 to 6 times. Very simple. Plus this increases your nitric oxide also. Not that amount. Humming is the one which is very effective. So if you want, we can start first for the humming. Everybody knows how to do it. Breathe 3 or 4 times from the nostril, and then you breathe out from the nostril with a humming sound. Oh. The next one you can do is Bhamri Pranayam. Now here technique is very, very important, please. First 4 fingers just above your eyebrows. Next 3 fingers slightly bent, put on your eyes, and you close your ear by pushing this lid in so that no outside sound is going in. I am going inside now. I'm not interested outside. And this is going to give me a lot of relaxation, lower my blood pressure, good for my heart and for my insomnia. So many benefits. So we'll do about 5 times. Breathe in from the nostril, exhaling from the nostril, mouth is closed with a sound of Om, or just you are humming, okay? Next, Untitled Pranayam. Hands are in Dhyan Mudra. Take a long deep breath from the nostril, chanting the word Om 5 times from the mouth. Next is Bhamri Pranayam. Pranam means Om, the supreme power. We are in the seat of silent meditation, which is very, very important to lower the blood pressure with various other benefits. Your hands are in Dhyan Mudra. Fix your mind either on your breath or the third eye and go on chanting the Lord's name inside. Think positive. Think of the divine, the supreme power, and go on chanting inside. You can carry on for a long time at home, and you can say inside, I am never alone. I am never alone. The supreme power is always with me. He's giving us so much strength, the guidance to help ourselves. We are thankful to Almighty. Thank you, Lord. Thank you. Thank you. Raise your arms up. Rub your palms. Put the palm on your eyes. Slowly open your eyes and move the hand. So these are the ones you can do. And as I mentioned, associated pranayam, which is going to help us. That is your Shitli, Shitkari. So we'll do that. First is Shitli. When we take our tongue out and breathe from the mouth, and then close our lips and exhale from the nostril. Okay? This is going to help us to lower our blood pressure, take away the heat from the body, the acidity, good for the heart also. And good for your mouth, the gums, the teeth. And when you do this, you instantly feel some cooling effect going down from your pharynx to your esophagus up to your stomach. You feel that. Hands are in any mudra you can put in. Dhyan Mudra. Lift up your spine. Take out your tongue and go on breathing. Shitkari, as if the food is very hot, chili wise. We do tsi. Same thing you are doing. The benefits are same again. We'll do 3 times. And close your lips and exhale from the nostril. The warm air will be coming out. Well done. The next one is Chandravati Pranayam, which is very, very effective to lower the blood pressure. Very simple. Here, when we breathe in, there shouldn't be any sound. This is known as soundless breathing, because this is our Chandranadi, the cooling effect. Give us more shanti, peace, calmness, very helping. And this is connected to the right side of the brain. We close the right nostril, breathe in from the left nostril, slowly in, no sound, soundless. After breathing, you hold your breath, if you can. How long to hold depends on the practice. Then close your left nostril with these two fingers, middle in the ring, gentle pressure, exhale from the right. So we'll do 3 times. Close the right nostril, breathe from the left nostril, soundless breathing. That is the difference from the Lom-Vilom, that is alternate, plus there can be very little sound, but here is soundless. So for that, we have to make sure our nostril is completely clean. Otherwise, that mucus will be jumping inside. Okay. This is very good if you are sweating too much. This will help us. Many people, especially the menopausal women, they get these hot flashes, night sweats, very edgy. For them, this is very good. This one is very good, plus your Untitled Pranayam and Bhamri Pranayam. They are very good for menopausal problems. So we have covered most of it. The next one is, while you are doing your asana, you do gentle asanas also you can do. Don't spend too much time on that. Next one is your Shavasana. Shavasana, everybody knows how to do it. You lie down, relax your body and the mind, and you do your Shavasana. Time doesn't permit to do all this. And then the most important is Yog Nindra. Yog Nindra, when you carry on with the Shavasana for a long time, you go into Yog Nindra. They are the one which is going to help me for my hypertension, my heart problem, my insomnia, my stress, any type of stress. You need Shavasana and Yog Nidra. Maybe next session, if you permit me, I will do that demonstration, because to get the good effect, it can't be done hastily. At least you should do for 10 minutes Yoga Nidra to get its effects. So we have covered all that. The next one is very easy way again, laughter yoga. Laughter yoga is the one which is a stress buster. Any stress of any kind you get rid of by doing just laughing. We are laughing for no reason, no jokes, no stories, just looking at each other and laughing. But again, severe hypertensive, no. Severe hypertensive, no. Only for mild. Mild one can do. Gently again, not like others, not too much jumping because you're going to damage yourself. So these are the precautions one has to keep in mind, that you can do laughter yoga depending upon the severity of your hypertension. Too much. I have no hypertension. 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 Say yourself. मुझे कुछ नहीं है. मैं ठीक हूँ. I am getting better, better and better every minute. I am not hypertensive. Beginning में मैं hypertensive बनी थी ना आपके लिए. I pretended to be hypertensive patient in the beginning, but I am not, luckily. So I'm saying, even if you have got, say I haven't got. I haven't got. Once we uplift ourselves, things are disappear. Life carries on. The next year, very gently we do sing asana, very gently, because I'm again hypertensive. So very gently I will do, because there are so many benefits. You're opening up your sinuses, your eyes, your ears, good for your throat, you're activating the thyroid gland, parathyroid gland, vocal cords. So we need that, but we do gently then. Well done. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashantu ma kashchit dukha bhag bhave. Om Purnida Purnidham Punyat Purnmujjate Purnasya Purmadhari Purmeva Vashishyate. Hari Om Tat Sat. Hari Om Tat Sat. Hari Om Tat Sat. Om Shanti Shanti Shanti. Thank you very much, my friends.
Dr. Kapur, thank you very much. That was excellent. And lovely on hypertension. One thing I found also, remember you're talking about the left breathing from left side lowers your blood pressure. So what I found is you put a cotton bud on your right ear, that will make your left side predominant.
Right. Thank you.
Just with doing that, you'll lower your blood pressure. So you put some cotton bud in the right ear, and when you do breathing, automatically your left side becomes predominant. And your blood pressure gently comes down. As you said, it's not just the yoga. You have to do intermittent fasting. जीते हो खाने के लिए या खाते हो जीने के लिए, उसमें थोड़ा सोचना पड़ेगा. Also, good bowel movement. Constipation is one of the biggest cause. More gas you create, it travels up, so it gives you palpitation. It's like high blood pressure. It's the same kind of symptom like heart attack. So really make sure you have a good bowel movement. Every illness happens in the stomach. As you told us before as well in the constipation section, you did before as well, I know. I'm just highlighting it because in the day, it's hypertension, as you said, it's a silent killer. Doesn't give you any warning. Ram Nam Satya, Mudra Bada Masta. So really, it was an excellent class. I can't thank you enough. But one thing I'll say, tomorrow, I'm sorry, just highlighting again, tomorrow class, Maniji, I've got another class to go. I'm taking a class for somebody, one of the company, Park Head, a housing association, want me to do yoga 9 to 10 o'clock tomorrow. So you have to act like I'm on a holiday. You have to do it, take the class tomorrow if you don't mind.
Okay.
Won't mind, Kaushalaji. I'm sorry. I just thought, and thank you, everybody. Listen, I think we'll do another good laughter for just to unmute yourself. Just give everybody good morning, everybody. Give a big laugh, a big smile on your face. Ah, 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 ah,
Thank you very much.
That was a
Thank
lovely
you.
session. Lovely session. I can't thank you enough for
It was
Dr. Kapur.
excellent.
And again, I'd like to thank
Oh,
Thakur Bhai
Thank you
and
so
Mani
much.
for all the support.
Thank you.
Thank you so much.
Thank
you, Guruji.
Thank you, Dr. Kapur.
Thank
Thank
you.
you.
Thank you, Mrs. Kapur. That was
Thank
very
Very
nice.
nice.
Thank you
Very
very much.
Jai Shri Krishna.
Jai Shri Krishna.
Thank
Jai
you,
Shri Krishna.
Oh,
Charanjit,
Yeah, boलिए.
so
Yes.
can you say about the cotton bud again? Is it in the
Yeah.
left ear, right ear?
No. See that whenever, if you want to breathe from left side, then you
Yeah.
put a cotton bud in right ear. If you want
Right
to breathe
ear.
from, if you have
The
low
cotton
blood
bud
pressure,
in right ear.
yeah, if you have low blood pressure, then you put a cotton bud in left ear. That makes the right
Yeah.
more predominant, opposite.
Thank
Like
you.
Mani has slightly low blood pressure. If you put something in the right ear,
The right,
left
no,
ear,
in the left
that'll make
one.
the right side more predominant.
Yes.
Okay, so you put, for the high blood pressure, you put the cotton bud in the right ear
Right, that's right.
and breathe through the left nostril, in
No,
and out.
automatically left becomes more predominant.
Okay, thank you.
Mani, you were saying something? Sorry, you're asking something,
No,
Mani.
no. If people want to ask any question, Dr. Kapur. I was
can I
just
ask one question, Kapurji?
Yeah, बोलिए.
You said, in fact, even if you have lack of sleep, you get a high blood pressure, in fact. Like I am actually suffering with the sleep, in fact, for a very, very long time. What could I do to improve the sleep at night?
Now
I
the thing
don't
is,
have
this
that
is
much
again
stress
a vast
even.
subject, insomnia. We have to make sure why you can't sleep. There's so many reasons. Not
Wow.
sleeping, not only blood pressure. There's so many reasons why people are not sleeping. And this is a sort of chronic condition for them, From the
Yes.
very adulthood, they are not sleeping. They're not sleeping. But just not sleeping is giving you every problem. You are more edgy, you can't work, you feel fatigued, tired, irritable, constipation, high blood pressure, and various other problems also. So if you want, this subject should be covered in detail. First, we have to analyze. You have to prepare your diary also. What you have eaten, which person you have met, who has upset you. So many reasons for can't sleep, and it's a very common problem. Then you may be suffering from menopausal problems also. This is another one which is giving us a lot of insomnia, hormonal problems, So that's what I humbly request. This should be covered in detail, given enough time. There's not shortcut answer to one. Why I can't sleep? Why? Is it regular or it is just episodial, on and off? When somebody disturbed me or I had a bad news coming up, financially I am low, I've lost my house. These points are very important for the sleep, And then again, what is your sleep pattern also? Do you follow the same routine or you haphazard? That makes a lot of difference. So my humble request is, this is a very vast topic again. Insomnia, but very interesting topic. Your pineal gland is not working. Where I put my bindi, I'm activating my pineal gland because there is a hormone produced for the sleep only. Why we are getting sleepy at the evening? Why not when the sun is rising? Because the level of that hormone is going up in the evening. That's why God made light for sleeping, not the daytime sleep, nighttime. This is a hormone which is affected. And how to activate this? As a therapy for not to sleep, we activate this, our gland. To activate this gland to get the sleep. For that, we do a lot of meditation and activate this area. Third eye.
Dr. Kapur, I can say something here for the sleep problem. What I've found, if you activate the biggest nerve, but the best way to activate the biggest nerve is if you fill your mouth with lukewarm hot water in your mouth and blow your mouth and then blow and throw cold water on your face for 10 to 20 times. That will activate the biggest nerve, also takes away the foreign material in your eyes and reduces the pressure behind your eyes. That makes you sleep well. When you hit the pillow, just do meditation, relaxation exercise, Gyan Mudra, breathe in and slowly relax your toes, your calf muscle, your legs, your stomach, your heart, your throat, your face, facial muscle, and suddenly you go in the in the trance and you fall asleep. That's one of the simplest way it will give you. I can guarantee if you try that tonight, Ramesh Shahji, that's the name I saw on the screen. It will help you to sleep better. But as Dr. Kapur said, it's not a simple answer. It's lot depending on what's causing you stress.
Yes,
First, you have to what's causing you. Sometimes all night you're dreaming about what you will do tomorrow. So your mind is working away all night. It's not so. And to sleep well, you have to have a power nap. Power nap is like a deep sleep. That's when your brain has a valve. When the blood flows through, produces spinal fluid, and that able to go in your spine, energizes the organs, and gives you energy and promote good health. So it's very all these lot of Dr. Kapur, you can't answer that in 5 seconds, but I give you a quick fix. If I guarantee if you do that tonight, you will sleep better.
Right, okay. I'll try it. Yes.
Try. Thank you very
Yes,
much and lovely. All of you
Thank
have a
you.
lovely
Thank
day.
you so much.
Thank you to
Thank
share.
you all.
Thank you very much.
Thank you.
Kamalji,
Thank you,
can I
Dr. Kapur.
request?
Take
Can
care,
I
everybody.
request because
Have a nice day, everybody.
this is now very nice people are asking these questions.
That's right.
Hypertension was done because Shakuntala asked this question. I said I can't reply in this session. It was already half time.
Very
So going back to Ramesh ji, you do like this. You analyze yourself, and then we can do sort of presentation of your
That's
case and cover insomnia completely. Nothing personal. You analyze yourself because on the Zoom we can't ask everyone. Face to face we can ask, but not in the Zoom. But if we have one representative who start the topic and then we carry on, that
Yes.
works much helpful.
And also another thing I do every night is I do breathing exercise or physical exercise nighttime before going to bed. When you do that, body gets so tired, that automatically you fall asleep. There's a lot of whatever works for you. That's important. 5 fingers on equal. We all have different kind of body works differently, So
So
Lily,
do you have, sorry,
only go Bharti.
how long before you eat can you do the physical exercises? It used to be 5 hours.
No,
Do
but
you
what I'm
have-
saying is it takes 4 hours to digest the food. That's what Swamiji says, certain exercise or Kapalbhati don't do 4 hours after the meal time and things like that. But really, and आप खाना खा के भी करते हैं exercise तो क्या होगा पेट साफ हो जाएगा आपका clear your bowel. That's so
Yeah.
really there's no horses for courses. You have to look at yourself and see what works for you. Like I
Yeah.
said to you, everybody has different kind of metabolism. हम खाने के बाद रोज वॉक करते हैं 5,000 स्टेप उससे हमारा मेटाबॉलिज्म बढ़ गया तो आप फाइंड I'm losing weight automatically. Even in a holiday I ate a lot, but I did 20,000 steps every day, and
I
my
need
my
to
weight
do
is
that.
still same. My weight is still same as what I went with.
Well done.
So what I'm saying is, if I can do it, all of you can do it as well. But you have to put some resources, some effort towards that thing, isn't it?
Yes.
करना पड़ेगा करो योग रहो निरोग है कि नहीं तो ये बोलते हैं
Thank you.
Thank
very much.
Thank you. Take care. Have a lovely day, all of you. है ना?
Thank
Thank
you.
you.
Thank
Thank
you
you,
very
Jyoti
much.
ji. Lovely smile, Jyoti ji. Oh.
Jai Shri Krishna. Bye.
Oh.
Bye bye.